Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question is, what is the relationship between narcissism and physical abuse? To help answer this question, I'll be using an article from 2015 by Crouch and colleagues, and I'll put the reference to this article in the description for this video. Now, when we talk about narcissism and any type of abuse, we oftentimes think of the term narcissistic abuse. And what this term means is in a relationship between a parent and a child, or in a relationship between two adults, one individual could have traits of narcissism, and that could contribute to abusive behavior. For example, gaslighting is a term we hear associated with this. This is when somebody with narcissistic traits tries to convince somebody else that they have mental disorder symptoms or distressing symptoms. The individual with narcissism tries to make it appear as if that other person is the problem in the relationship. So this term narcissistic abuse can refer to a relationship again between a parent or a child or two adults, but it's not an official term. It's more a term we see in the popular culture. It's not defined for use in mental health treatment, and there's no type of syndrome or disorder or condition listed in the DSM that's related to narcissistic abuse. For example, if we search the term narcissistic abuse syndrome, or narcissistic abuse disorder, or narcissistic victim disorder or syndrome, we can see a lot of different results for that, but these aren't articles that were published in a scholarly journal. These are just articles or videos that are of interest in this topic, but they're not informed from science. Now, this doesn't mean that narcissistic abuse can't lead to some sort of syndrome, disorder, or classification. It just means there's not an official classification for this. And that's because the consequences of what we refer to as narcissistic abuse don't tend to cluster together. We don't tend to see the same symptoms over and over, although certain symptoms, of course, seem to be more common than others. For example, general distress, anxiety, worry, nervousness, codependency, symptoms associated with emotional dysregulation. These would be fairly common, but again, they don't cluster together in a clinically useful way, or at least we haven't discovered that yet. Therefore, there's no disorder associated with narcissistic abuse, but that doesn't mean that some sort of classification isn't theoretically possible. Now, we also see that the term narcissistic abuse doesn't come up in the research literature very often. That's because this isn't a specific term that's the focus of research. But that doesn't mean that this construct doesn't exist in the research at all. We study trait narcissism, we study pathological narcissism, and sometimes narcissistic personality disorder, and we look for the effects that these behaviors have on other individuals. This would be very similar to the construct of narcissistic abuse. So sometimes it's really just a matter of terminology that gets people confused when looking at what's involved with the popular culture, what's popular, and what's common in research. Now, to briefly touch on these constructs that we look at in the research literature, of course, narcissism, we see a sense of entitlement, we see arrogance. Pathological narcissism is divided in two different categories, grandiose and vulnerable, and I'll explain more about those in a moment. And narcissistic personality disorder is a cluster B personality disorder in the Diagnostic and Statistical Manual. So this is an official diagnosis that somebody can receive, and oftentimes we think of it more associated with that grandiose narcissism that I'll get to in a few moments. Now, narcissistic personality disorder has traits like a sense of entitlement, a grandiose sense of self-importance. We see a lack of empathy, arrogance, and a number of other characteristics. These traits and the other traits of narcissistic personality disorder, as well as the traits we see associated with pathological narcissism in general, do have consequences. They cause suffering, and they can lead to abusive situations. We know, for example, that narcissism is linked to intimate partner violence. It's also linked to child sexual abuse. But the question today is really looking at child physical abuse. So does narcissism have a relation specifically to child physical abuse? Well, to understand this, we have to understand a little bit more about specifically the two types of pathological narcissism I mentioned before: grandiose or overt, and vulnerable or covert. Now, the article I'm using here really centered on overt versus covert, as opposed to grandiose and vulnerable, so I'm going to stick with the terms they used. So I'll stick with overt versus covert. So with both overt and covert narcissism, we see some similarities. We see self-centeredness, we see intolerance, mistrust, an excessive need for admiration, and the disregard of the needs of others. Specifically looking at how to differentiate overt from covert. With overt narcissism, we see a sense of entitlement, dominance, a sense of superiority, and a tendency to exploit other individuals. So again, it lines up fairly well with the definition of narcissistic personality disorder. With covert narcissism, we see a tendency to experience shame. This is referred to as shame-proneness. We see sadness, insecurity, hypersensitivity, and anger and aggression. Now, there hasn't been a lot of prior research on the relationship between narcissism and child physical abuse. We do see a few articles, and we see the prior research really implicates covert narcissism as a risk factor for child physical abuse. We don't see a lot of evidence supporting a relationship between overt narcissism and child physical abuse. Also, the prior research really didn't look at how negative affect could contribute to child physical abuse. We know that certain negative affective states are associated with covert narcissism, including tension, dissatisfaction, anxiety, worry, moodiness, and bitterness. We also know that negative affect has been associated with certain parental behaviors like aggressiveness, being punitive, controlling, and being rejecting. So it makes sense that covert narcissism may come together in a special way with negative affect to contribute to a risk of child physical abuse. So in this study, they measured trait narcissism, negative affect, and the risk of child physical abuse. Now, this is an important distinction from measuring actual child physical abuse. So research studies focus on measuring the risk of child physical abuse. And the instrument used here is actually a fairly reliable and valid instrument. So we have these different measures: narcissism, negative affect, and child physical abuse risk. And then this study looked at the relationship between these factors. So what were the results from the study? Well, they found that covert narcissism had a significant association with child physical abuse risk, meaning as covert narcissistic traits tended to increase as the levels increased, the level of child physical abuse risk increased. So this was a positive association or positive correlation. We also see that negative affect, these states I mentioned before, like anxiety, worry, moodiness, they partially mediated the association between covert narcissism and child physical abuse risk. So to understand what partial mediation means, I'm first going to explain mediation in general. So what this means is that certain constructs can explain how or why two other constructs have a relationship with one another. So for example, if negative affect fully mediated the relationship between covert narcissism and child physical abuse risk, that would mean that covert narcissism leads to negative affect, and negative affect leads to child physical abuse risk. Now what we see here is, again, a partial mediation. This means that covert narcissism has a direct relationship to child physical abuse risk, but also an indirect relationship through negative affect. So sometimes covert narcissistic traits can lead directly to an increased risk, and sometimes they go through negative affect, and the negative affect contributes to the increased risk. So again, this is a partial mediation. Negative affect partially explains the relationship as to why or how covert narcissism leads to child physical abuse risk. The last finding of the study that I'll cover here is that overt narcissism did not predict increased child physical abuse risk. Now, this might be a bit of a surprise to some, but we know that covert narcissism does have that stronger association with aggression and anger, as I indicated before. Overt narcissism really doesn't have that same association. Now, this doesn't mean that overt narcissism can't be associated with other types of abuse, like emotional abuse and sexual abuse, like I mentioned before. It just means it doesn't seem to predict child physical abuse. Now, this is interesting as well because overt narcissism, again, is strongly associated with narcissistic personality disorder. And sometimes we see, instead of the term narcissistic abuse, individuals will use the term narcissistic personality disorder abuse. But really, narcissistic personality disorder doesn't contribute to all types of abuse. Specifically, it doesn't seem to have, again, an association with child physical abuse. So we may need to rethink how we use different terminology. Narcissistic abuse is a term that people find to be useful because it describes one of their experiences, but it's not really a specific term that we can use clinically. We have to distinguish between overt and covert narcissism. So the specific terminology related to narcissism may be more useful from a clinical perspective, more useful in terms of forming treatment planning, for example. I hope you found this description of the relationship between narcissism and child physical abuse to be interesting. Thanks for watching.